Dr. Phil Boyle developed and founded NeoFertility in Ireland in 2016 after 20 years of experience in the field of restorative reproductive medicine. He graduated from Galway University in 1992 and is a member of both the Irish and Royal College of General Practitioners. He is a member of the Irish Fertility Society and is currently president of the International Institute for Restorative Reproductive Medicine. Dr. Boyle is also a co-founder in the Chart NeoFertility app. He has helped over 3,500 couples achieve successful pregnancies, many after years of infertility, repeated miscarriage, and failed IVF. So we hope you enjoy this episode. Welcome back to the NFP Podcast.
Welcome to the NFP Podcast, where we explore the empowering world of natural family planning. I'm Amy Smith. Join me and my co-host Emily Appledorn each week. Together, we're here to dive deep into the science, the stories, and the spirituality behind NFP. Every week, we push back against the free love culture and advocate for a culture of responsible love, where intentionality and respect are at the forefront of family planning. Join us as we discuss everything from the practicalities of charting and fertility awareness to the profound impact NFP can have on relationships and communities. Whether you're new to NFP or a seasoned pro, our podcast is your go-to resource for honest conversations, expert insights, and real-life experiences. So grab a friend, settle in, and get ready to be inspired. This is the NFP Podcast.
All right, guys, welcome back to the podcast. It's just me today. Emily is watching her kiddos, and I'm not alone, though. I'm really grateful to be joined a second time on the podcast by Dr. Phil Boyle. Welcome back to the podcast, Dr. Boyle.
Thank you, Amy Lynn.
Glad to have you here. Dr. Boyle agreed to come on to talk with us a little bit about egg freezing. This is something that, at least in America, has been on top of mind given just some recent cultural conversations and cultural figures that are talking about egg freezing. And so I reached out to some of the medical professionals that I know to ask if anyone would like to come on to discuss this topic. And Dr. Boyle graciously responded that he would be interested in doing that. So Dr. Boyle, maybe we could just kind of set the scene or frame the context for our listeners and let them know what is it that we're talking about when we say egg freezing.
Sure. Would you mind if I just start with the story and then I'll go into the details of
Please
it?
do. Yep.
So I'm very hands-on practical when I deal with these issues, and I got a few stories actually that encapsulate it very well, and then I'll go into the details of what it is because I think the human interest stories are actually very instructional. So I work, as you know, in the whole area of restorative reproductive medicine, and our whole question is why? Do we have fertility problems, and what do we need to do to make best conditions so couples can have babies together? And this question about egg freezing, it's a global issue, and it's affecting us in Ireland as well. I did a quick search before we started, and I just put a quick search into my search engine, and it came back and said, I just asked the question, what percentage of women currently doing IVF are doing it just for fertility preservation? And the number that came back to me is 42% in the US.
Oh, wow. And now let's
So
just
it's
define that
huge.
again. So fertility preservation would be a woman who we're presuming has a healthy state of fertility. She's ovulating, she's fertile right now, but she'd like to prolong her fertility, perhaps past a time where she would eventually just naturally not have children anymore. Is that correct?
So the context is that it's well recognized the single biggest factor that causes a decline in fertility is advancing age. And the challenge is there with science and technology. Can we cheat this ticking clock? Because it's a thing we've all known for the longest time. The clock is ticking. You can't leave this. You need to start your family now. And everybody's going, but I've got a career. I've got a life. I want to travel the world. Can I not just do something to preserve my future fertility? And the truth is, we really can't preserve it that well at all. That's the bottom line. And with 42% of women going for hyperstimulation, they produce a year's supply of eggs in one go. And then a healthy woman who has no fertility issue at all, by going through the process of pumping her full of hormones to get a year's supply of eggs, a needle is inserted into her ovaries to extract those eggs. And then those eggs are extracted if they can get them, and they're frozen with a view to using them at a future date. Now the problem with egg freezing is that they don't freeze very well, and you don't have as many embryos then later on. So there's eggs and there's embryos. So when an egg is fertilized, then it's an embryo. But most of these women don't have a partner, so they just freeze their eggs. And then later, the only way they'll be able to use those eggs is only with an IVF cycle. You can't get pregnant naturally with that. But the problem is, you take somebody who's healthy, who doesn't have a fertility issue, and you go through the process of hyperstimulation and egg retrieval. There's risk associated with that. It's not a risk-free process like getting your tooth out, which even carries a certain amount of risk. So you can develop, potentially, you may make it more difficult to get pregnant afterwards, because when you insert a needle into that space to recruit the egg, there's at the very least a theoretical concern. You may develop scarring or adhesions around the pelvis and fallopian tubes that could theoretically affect future fertility. Because what we do know, there was a big study in Spain looking at the fertility outcomes with restorative reproductive medicine in Spain. They are primarily using naprotechnology, and they found the more times somebody had tried and failed IVF, the less likely they were to get pregnant naturally afterwards. So our question is, we think there's something in the IVF process, possibly this egg retrieval and insertion of the needle, that is detrimental to your capacity to conceive naturally afterwards. So this false idea that, well, I can always freeze my eggs, and if I'm not getting pregnant naturally, by doing that, well, you may impair your ability to get pregnant naturally. And then the other side, I, for example, had a lawyer coming here, and don't want to give too much information. Ireland's a small country and people could figure it out very quickly, so I won't be too specific. But she was very self-assured that I've got 8 eggs frozen. I froze them in my early 30s. I'm going to be okay. So we got the treatment to work for her. And she was planning then to get a second baby. She came to us late 30s, early 40s, and with restorative treatment, we were able to help her to conceive. We weren't able to get the next one. Life was incredibly busy, and part of our process, we've got to take the stress down. But it was, anyway, life was intense. It was busy. We could not get it to work a second time, partly because she got older, partly because stress levels were higher. When she went to thaw her 8 frozen eggs, she had none that were available for, she tried to fertilize them, but she'd no embryos available for transfer at the end of that. So she was under the illusion that she had her eggs from 30-year-old me when she was 40, and they just weren't suitable for transfer. There's no embryos to put back. And that's a very common occurrence. We don't have good numbers on it, but she invested in that 10 years earlier. She paid for the hyperstimulation, egg retrieval, and an annual fee to keep them frozen, and then she'd no no embryos to put back. And if you think about it, well, there's never a guarantee, but we really don't have any percentages worked out. What are the percentage who are like this? We really don't know, because large numbers never get around to fertilizing the eggs and going for embryo transfer anyway. So that's a concern.
Dr. Boyle, I have a question here, just as I'm thinking. So, as an NFP teacher, we learn that follicle stimulating hormone recruits multiple eggs. And so there's follicles that start to build around multiple eggs each cycle, but ultimately only one follicle has a matures. And then that follicle is ruptured and that egg is released. And the other follicles kind of atrophy. Correct me if I'm not describing this correctly. So they would atrophy and die off, if you will. Now, I don't know if this is true, but do we believe that the process is that way and that only one reached a mature state because that's the best egg from that cycle? Or is it just it beat the others to maturity, but the other eggs are just as equally healthy as that one? It's kind of like
We
when
don't
you think
know.
of sperm. Okay, you
Mm.
don't know. Okay.
Yeah.
Okay.
But the idea that I draw a parallel with fruit ripening.
Okay.
So as it matures, you get a big 20 millimeter mature fluid filled follicle that has the egg in it. The egg grows and develops and reaches this point of maturity where it's ripe and it's ready for fertilization when it grows that level. A lot of the time with IVF, you get unripe, immature follicles.
Mm-hmm.
They haven't fully matured, but there's an
Mm-hmm.
egg there, and those eggs are aspirated with
Mm-hmm.
a view to freezing them for an IVF cycle. So they're not as well developed, they're not as mature, they're harder to fertilize, you're going to get fewer embryos, and the IVF process itself will generate a higher number of abnormal or defective embryos as a result of that whole process.
And again, correct me if I'm wrong here, but because when I've been working with couples, I'm trying to one of the things I highlight is, with cervical fluid, it changes the dynamics of the vagina and then the ability for sperm to navigate up into the fallopian tube. And in these lanes that are created when we have cervical fluid present for the sperm to move to where they need to be, there's almost like a natural weeding out process. If there's some bad swimmers, they're going to kind of get stuck and they're not going to get to where they need to be. And so it sounds like this almost with the egg maturation process that if we just kind of let processes play out as they should, there's all of these natural biological processes to, I don't, this sounds bad, but like to kind of weed out the things that are not going to be the most healthy, if you will. But then
That
when we're
makes
trying
sense.
to, yeah.
Yeah.
And so then,
So,
but so
yeah.
that makes so much sense to me then why IVF would have such a higher kind of fail rate, even in just the generation of embryos, is because we're relying on human beings to kind of just pick and choose the best egg and the best sperm. And we're doing it blindly, actually. Like we have no idea if this is the best egg and the best sperm, whereas almost our own biology is better at figuring that out.
Yeah, I'd be inclined to go with that as well. Um, but yeah, so we get back to the idea, okay, egg freezing, and it does work for some people, yes. But the percentages, we really don't know what they are. So then you come to this scenario, and this is the story I was going to start with. And so I had a woman who came to me. She was aged 21. She came in with her mother, and her grandmother went into early menopause, aged into her mid 30s,
Oh,
and
wow.
her mother the same. So they had a strong family history of early menopause. And they wanted to do the blood test for ovarian reserve for their daughter, who is now 20 to 21, to see what her egg reserve was like. And her egg reserve, the blood test is the AMH, anti-Mullerian hormone. So it's a measure of the amount of follicles that are in your ovary, and it can't be used to predict who's going to get an early menopause, but it can give you an idea of what your egg reserve is like. And its primary use actually is to predict how well you're going to respond to IVF. But clinically, we did have an idea and say, you know what, that is a little low for your age, the number that we got. So most of the time, and most fertility clinics would tell her, so I saw her now 10 years ago. So this is where I have the advantage of 10 years on and the story of what happened. So most clinics will advise her, well, with your family history and your blood test for AMH, you should do hyperstimulation, egg retrieval, freeze your eggs, and when you meet Mr. Right, go for IVF.
Hmm.
Whereas my take on it was, well, we think the reason why your egg reserve diminishes, there's an autoimmune component to it. I put her on the immune modifying treatment with low dose naltrexone, our diet and supplements. And I said, well, I don't know for sure because I haven't done this before. But I think we can stop your immune system attacking your ovaries, and I think we can help to preserve your AMH without having to put you through this whole egg retrieval process. Now, philosophically, they were open to the possibility of doing the egg freezing and all that goes with it. But they also were open to the idea, well, if there's an easier way we could do that, that would be very appealing as well. So trying to get to the root cause of it, we followed that strategy and on an annual basis continue to monitor her blood test for AMH. At first, the AMH went up and it improved. And then it gradually over the process of the next 9 years, gradually came down. And 9 years later, it was the same level as what it had been when she first came to me. So we didn't completely stop the process of the AMH slowly coming down, but it did get that jump and improved for a while. So long story short, She met Mr. Right. They decided it was time to have a baby. And when I checked her hormones, she was ovulating with low hormones. So I put her on treatment to balance the hormones. And annoyingly, we ended up having a miscarriage on our first go. The hormones were a little
No.
bit below the perfect range. And but long story short, next time we got it to work successfully. So she's only just delivered her baby, and
Oh.
she's in that position now where we can help to preserve her future fertility, and we're confident she'll go on, hopefully, to have. I don't know how ambitious she is, but she can have a repeat successful pregnancy because we've helped to preserve her fertility without going for this whole egg freezing process. So, my
Mm.
take on it is from my clinical experience, there's a better way of preserving your fertility. But the single best advice you can give to any couple who wants to have a baby is try and have them in your 20s. This idea that I can get as old as I like and I can put the eggs back anytime I want. Well, it's a mercy now that I'm getting older and my body's slowing down. It's a mercy to us that our fertility slows down. It's a young person's game. You need to have energy to run after these little ones and all that goes with it for you to enjoy them and for you not to be misperceived as being a grandparent looking after this little one. There's a reason our biology causes fertility to shut down because, like I
Mm.
say, you need to be young for it. So that take that into account. And what people don't really fully appreciate is we're meant to have our babies with female ages in our 20s. Life is changing to the extent that culturally, globally, that idea has changed. There's a very useful website. It's called birthgap.org. I highly recommend watching the videos that are there. It's quite secular, put together by Stephen Shaw, who's a data analyst, research scientist, and he just goes into the data. And globally, we're all below replacement level now. And the reason is because people are delaying when they're going to start having their family. They're still very open. They still want to have a family. But then the regret they experience as they try later in life is profound and significant. And my view is that's not going to be protected by egg freezing. I think egg freezing, it's I would say a largely unproven practice and quite an expensive practice as well. And the encouragement would be get into fertility preservation by a restorative philosophy and also the view aim to have your kids younger. Don't be going for this idea of having them when you're older. So that's broadly the context with it. I have a few other stories that I could mention, but if you just want to
No, no, yes,
pause
I'd like
there.
to hear. No, I'd like to hear those too. I guess I'd also just like to really highlight, which we talked about the first time you were on the podcast because we spoke so much about infertility, is this assumption. Well, I guess just it's a direct correlation, right? If we're freezing our eggs, well, then we have to use IVF in order to access those eggs to achieve a pregnancy. And the statistical rate of success of live birth with IVF, correct me if I'm wrong again, please, is less with IVF than it is with a restorative reproductive medicine approach to trying to achieve a pregnancy.
Correct.
And so how wonderful that even, in the restorative realm, the physicians are still looking at how to help women who find themselves in their later reproductive years, still trying to achieve healthy live birth outcomes and using alternatives to things like egg freezing, like you mentioned, trying to just help support the immune system in the case of someone having an autoimmune condition that's attacking their egg reserve. I also find it just so interesting as like a side note that, I was working with a couple just teaching a general NFP introductory class, and the female turned to her fiance and said, "Oh, maybe I should test and see what my ovarian reserve is." And I was like, that's just like a thing now that women are thinking they should do. And I was like, or just like start to have babies. Like it's almost like everyone's assuming they're going to have a low ovarian reserve. And so we need to have this test. We need to go through this egg freezing, like that this is going to apply to all these women. And it's like, well, no, we don't even know if you are going to be in that category. You could just have a baby, get married, have sexual intercourse, and have a baby, because that can also just happen too. Okay, so let's continue. Why don't you share with us maybe another anecdote along these lines?
So I had somebody who came to me because she was, I think, 37. She had been in a long-term relationship that had just finished, and she did her blood test for her ovarian reserve, found out that it was low, and she went to the IVF clinic, did the hyperstimulation, went for attempted egg retrieval, and there were no eggs retrieved through the process.
Hmm.
So now the kind of blood test result that she had for AMH, the units we work with are a little bit different than the American units, but she had a reading of 5 on her AMH, that's in her picomoles. That's just a little bit below 1. It's about zero point 0.7, I think, for the units you guys tend to work with. But it's very much within the capacity that we could work with that. And here's the bizarre paradox that now most fertility clinics will tell you that a blood test for your AMH has minimal capacity to predict your ability to conceive naturally.
Oh, interesting.
So, yeah, so we've people, couples with incredibly low AMH blood tests that we're able to get successful pregnancies with. But it does predict that your probability of success with IVF would be much lower, but it really has limited ability to predict your chances of conceiving naturally. Yet, despite that, if you're looking at the reasons for people doing IVF from the CDC data, they quote low AMH that the reason for doing IVF for 25 to 27% of couples is because their AMH was low. So it doesn't
Hmm.
fully add up because it doesn't stop you
Hmm.
getting pregnant naturally. So why is that a reason for IVF? In
Right.
fact, it's a good reason not to do IVF because your chances with IVF are going to be lower because your AMH is low. So
Hmm.
that's an interesting
Interesting.
thing.
Yeah,
So
that
this
really
poor
is.
woman, she was quite a low place, but I was able to reassure her and say exactly that just because you didn't get a successful egg retrieval for IVF, you very much are able to get pregnant naturally. So what I
Hmm.
didn't fully flesh out, but it's a pity you did that because having gone through that hyperstimulation and attempted egg retrieval, that is a factor that's going to work against your ability for natural conception. Now, as it turns out, she's still coming to me. That was 10 years ago. She's still coming to me for women's health. She never did meet the right person, so
Hmm.
she's still single and she's coming now for more other women's health issues. But
Hmm.
yeah, so that's just her
How
story.
interesting. I wonder if you could maybe explain a little bit more why this hyperstimulation is, has potential risks. And I'll just say, just to share a personal story. So, most of our listeners know that I have twins. They're going to be 5 next month already. But when I was working with the St. Paul the Institute, one of the protocols we went to was to use the drug Menopur to stimulate follicle growth. And this, what I was told by my doctor was that I was going to be given a very low dose, like the lowest highest dose she could give me to help stimulate follicle growth because I had tried Clomid and I had tried letrozole and they weren't working. And so I did these Menopur injections, which you inject yourself in your stomach with these needles at home. It doesn't feel good, but it did work in that I had follicles maturing, and I went for ultrasounds and had the follicles monitored. And then I was given what was called a trigger shot, is what was get told me, and it was the hormone HCG, and that ruptured for me 2 follicles because she said actually on the ultrasound, this is funny, people are always asking me like, did you know you were pregnant with twins? I was like, actually I really did because like I saw their follicles and then I took a shot to make them rupture. But I had 2 dominant follicles, and that's what the ultrasound or the yeah ultrasound report said, and that's what my doctor told me. She said, okay, we've got 2 follicles, so we'll do this trigger shot. And sure enough, we had 2 babies. We had fraternal boy twins. um, but I did read on the bottle that multiples can result from this and that there are medical side effects from this. And when I asked her about it, she affirmed that that was true. And she also affirmed me that the dosage that she was giving me was what she felt to be safe, and she didn't recommend us, doing this into perpetuity. And so we kind of weighed all the options and felt that okay, we felt comfortable then pursuing this as an option. And I'm assuming though, when I hear you say someone's retrieving a year's worth of eggs, they perhaps are not given the lowest dose of this drug to, try to stimulate follicle growth without going overboard. It sounds like the goal is to go overboard. So maybe you could just clarify if that is true, and then what would be some of the potential medical side effects of that?
Well, there's no studies to prove that that causes any harm.
Mm,
Now, if you just with using a bit of logic and reason, you would imagine surely producing a year's supply of eggs in one single cycle and sending your hormones to super high levels, surely that can't be good for you. There must be some risks with it, um, but there's nothing that's been proven with that. So there's theoretical concerns, but there's been nothing proven. And that's the beauty, I would think, with a restorative approach is that there isn't even a theoretical concern because while the side effects listed from potentially excessive overstimulation, very much our intention is one follicle and one egg at a time. And on occasion, you're going to get a second one recruited. Very, very occasionally, we get a super surprise, and there's a third one there,
right.
which for us, it's like a 700 to 1 chance, and we get twins about 2.5% of the time, which is probably the same as what the St. Paul VI Institute would get as well. So you
Hmm.
can't completely avoid getting a twin pregnancy when you go for the fertility medications, but you do everything you reasonably can to avoid it. So the
Hmm.
beauty is there isn't even a theoretical concern of harm, where at the very least, you could argue whether there is a theoretical concern that sending your hormones that high, certainly the immediate effects are you don't like how you feel. You get bloating and you get breast tenderness, you get extreme mood changes. There's also the risk of developing ovarian hyperstimulation syndrome, which is
Hmm.
a very serious condition that can happen with IVF as well and
Hmm.
can be very problematic. But thankfully, we don't get any of those side effects at all.
Oh, that's
Um,
amazing.
yeah.
Um, okay, so we've talked a little bit about kind of what the process is, that the outcomes are going to be, it's going to be whatever IVF outcomes are, because that's what we do with eggs that are frozen. I guess, I feel like you can only talk right now anyway, it seems so much about the statistics and the medical approach and the medical side without actually
Yeah.
talking about any philosophical underpinnings of like how the human is viewed and how.
Even yeah,
Go ahead.
even before we get there, I think there's another
Sure.
real important point that's very
Oh,
much
sure.
worth raising, and that's for fertility preservation for those with cancer.
Okay.
So yeah, and there is a good way to do that that still allows you to conceive naturally afterwards. And there is a technique, it's called ovarian tissue freezing.
Oh,
So that's
interesting.
where, yeah, so they can take a slice of the ovarian tissue, they can freeze that ovarian tissue, and at a much, much later date, that can be surgically, so it has to be done surgically, but it could be surgically reimplanted in the ovary, and the woman can then ovulate with these eggs that were cryopreserved, say that it was taken from when she was much younger, and then she's releasing these eggs that are actually much younger, and she continues to ovulate in a very healthy way, and that's one way around it. But it is a surgical procedure twice to get the ovarian tissue and then to transplant and put it back. But the beauty of it is you don't do anything to interfere with her ability or capacity to conceive naturally afterwards. And
Wow.
lots of women can conceive naturally with that ovarian tissue cryopreservation approach. The only problem is it's not widely practiced. So it's a thing you can Google to see where are the places in the United States that do it. It is practiced there, and it is a very good technique, and it's one that you don't have the ethical dilemmas, and it doesn't mean that you have to resort to IVF to conceive afterwards. So it's a lovely potential solution for women that are in that situation.
That is fascinating. How did
Mm.
that process come about? Do you know, like, who thought, oh, what if we
It's
did
just
something
been
with the tissue?
gradually, yeah, over the years, different researchers have looked at this as a possibility and they've improved the techniques further and further. And there's hospitals that specialize in doing a very good job with that. It's not very well publicized as much as it ought to be because
Right.
it's such a lovely solution. But then it takes the IVF part of it out of the equation.
Right.
If it's done in the right way and the ovaries are left where they are. Sometimes
Right.
the problem is the ovaries are moved up around the kidneys, sometimes to get them out of the way. Maybe if they needed to target chemo or radiotherapy in that
Right.
area. So provided you can keep the ovaries in their natural position, then very much natural conception is an option.
So this is only right now prescribed for women who have gone through chemo and cancer, not for anyone
Yeah,
else.
I think that's
Okay.
that's the group that it's right for. So ovarian
Gotcha.
tissue cryopreservation to preserve your fertility in those more extreme cases. But the idea that, well, I want to do that to delay the onset of the menopause or to extend my capacity. If you're releasing the eggs of a 30-year-old when you're 50 and you get a fine, healthy baby, it's a job running after them as you get older. So you got to
Mhm.
factor that in and do go anyway. Go for your 20s and maybe your 30s. But although we've had our notable exceptions, having babies into the 40 plus, the percentages are getting tighter all the time. And you do yourself a big favor by pursuing a family when you're younger.
When you're older. Now, because it obviously is not just about the egg, right? The egg has to be released, the sperm has to fertilize it, and then the baby has to get into the uterus and stay in the uterus for 9 months. So, as a woman ages, obviously, we've talked about this already, that her ovarian reserve is decreasing. Is there, if she were to get pregnant, so say she does the freezing, right? And then she goes through the IVF, and now she's 45, and the baby, the embryo, the baby is implanted. Is there also a change in the structure of her uterus? Is that a reason why women are not able to successfully achieve live births later on too?
No, that doesn't seem to be so much of a problem. So it's
Interesting.
really
Okay.
down to aging of the eggs. Yeah.
So
So you have
interesting.
women
Okay.
that are in established menopause and they can wake up the uterus again, and you could potentially, yeah, have women in their late 60s having
Wow.
babies by waking up the uterus if you use the eggs of a younger woman to transfer
Okay.
it. You know.
Wow, that's so interesting. Okay.
Mm,
So the uterus seems to be fine as women age. It's really about
yeah,
the eggs. Okay.
yeah,
Hence the egg freezing. Wow.
yeah.
Okay. Anything else, Dr. Boyle, you can think to share before we wrap up?
Well, I think that's the big thing that I think that unfortunately um, that for whatever reason there's a misperception that you can delay childbearing through freezing your eggs, and that's a lot of women do that without giving it sufficient thought. And part of it is it's difficult meeting the right person, and life gets so busy with so many other things that are going on. But I think we need to get back to the idea of prioritize starting a family in your 20s or early 30s, and aim to do that sooner, and all that goes with it. And don't just assume because the technology is there and because everybody is doing it that that's going to be a way out of it. It really isn't. So just to keep that in mind.
Yeah.
And
Have realistic
um,
expectations.
yeah, and then for people who are stuck in that position whereby they have a very serious medical reason, ovarian tissue cryopreservation, fantastic option that doesn't breach any moral boundaries. And then this other idea, well, very often the reason, if it's especially running in a family of early menopause, we've got medical treatments such as low dose naltrexone, a very safe, healthy immune modifying strategy to preserve fertility for people who are at risk with a family history of early menopause. So that's a real
Yeah.
nice option.
So interesting. I think too, as we kind of wrap up, just reminding people the first time you were on the podcast, and I'll link to that episode in the show notes for people to go back and listen to because it was a great conversation as well. You shared so beautifully. Emily and I really love this expression, and we held on to it that children are a fruit of our love and not our labor. And this whole, even just a conversation of freezing one's eggs or freezing eggs, and then those eggs being used either in IVF or you're selling them and they're surrogates, all the things that can kind of come about from this practice. We're really changing it from life being a gift and life being an act or a fruit of one's love to a commodity, that females are egg, men are sperm. We just need to get these two things together somehow, some way, put them in somewhere, they can grow, and then out can pop this baby that we really want to have. And as some people that I really admire say, like we have just sacrificed children on the altar of adult wants and desires and dreams and our timelines, and have not done it the other way, where we're to sacrifice and surrender to just our biological reality, which is that there is a set number of years where men and women are fertile together, and women's fertility closes at a certain time and they're no longer able to have children. And I've also heard, I'm sure you have too, Father or Dr. Boyle, that like I have heard from women that when they get to that season where they are not able to have children anymore and that door is closed, how they go through a mourning period almost. Even women that previously perhaps expressed, no desire to ever have children and they were fine not having children, that there was a sense of mourning of like, oh my gosh, it's just not even an option anymore. So to your point, capitalize on the time when it is, high likelihood you're healthy, young, you've got the energy to also keep up with all the little people that can be produced there too. So I just wanted
Exactly.
to share that as well.
Yeah.
So,
No, that's a
okay. Well,
useful
thank you.
overview. Think you got it all. Yeah.
Yeah, good. Okay. Thank you so much, Dr. Boyle, for your time again today. And everyone, check the show notes. I will link to some of the resources that we had in our previous episode with Dr. Boyle, to his practice, Chart Neo, and the birthgap.org that he mentioned as well. And then, Dr. Boyle, maybe we could also share if we have like a link to the cryo freezing, the ovarian tissue, so
Sure.
that we
I'll
can
be
share
able
that
to
with people too.
look that up for you, and
Okay.
it'll be useful for you to have. Absolutely. Yeah.
Great. Okay. Thank you so much, Dr. Boyle.
All right, Emelyn. Thank you.
Take care. Bye.
Bye.
That wraps up another episode of the NFP Podcast. Thank you so much for joining us today. We hope you found our discussion enlightening and empowering. Don't forget to subscribe so you never miss an episode. We'd love to hear from you. Please connect with us by sending us an email with your questions and stories to thenfpshow@gmail.com. We'll be back next week with more insights, tips, and heartfelt conversations about natural family planning. Until then, love responsibly.